Hello everyone, welcome to my channel. I'm very proud to meet you today to discuss something very common in our everyday life that we pay little or no attention to. What am I trying to discuss with you today? Addiction. Yes, addiction. Addiction is a complex condition characterized by the uncontrolled and compulsive use of a substance or engagement in a behavior. Despite negative consequences, it is often classified as a brain disorder as it affects the brain's reward system and leads to a strong craving for the substance or behavior. Addiction can involve drugs such as alcohol, nicotine, opioids, or illegal substances, as well as activities like gambling, gaming, or shopping. It is considered a chronic relapsing condition that can have severe physical, emotional, and social consequences. There are two main types of addiction: psychological addiction, physical addiction. But in-depth studies have further broken it down into three main types, that is behavioral addiction, substance addiction, and impulse addiction. But in today's discussion, we are going to limit ourselves to only behavioral addiction, which is the most commonest among us. Yes, substance abuse is not the commonest. The most commonest is behavioral addiction. Because even with substance abuse, its primary cause is behavioral addiction. Behavioral addiction, also known as a non-substance addiction or process addiction, is a form of addiction that does not involve the use of substance, but rather revolves around engaging in certain behaviors. These behaviors often provide the individual with a rewarding or pleasurable experience, leading to a cycle of compulsive engagement and an inability to control or stop the behavior despite its negative consequences. Examples of common behavioral addiction include gambling addiction, internet addiction, shopping addiction, sex addiction, food addiction, work addiction, and exercise addiction. These behaviors activate the brain's reward system, releasing dopamine. Dopamine is a neurotransmitter that plays a crucial role in motivating pleasure and reward processing in the brain. It is produced in several areas of the brain and acts as a messenger between neurons, transmitting signals to regulate different physiological and psychological processes, and creating a sense of pleasure and gratification. Over time, this can lead to a dependence on the behavior, with individuals experiencing cravings, withdrawal symptoms, and a lack of control over the actions. There are several causes of behavioral addiction. Some of the most common ones include dopamine release. Yes, the number one, dopamine release. Behavioral addiction often involve activities that trigger the release of dopamine, a neurotransmitter associated with pleasure and reward. This can lead to a cycle of craving and repetition as the individual seeks to re-experience the pleasurable feelings. 2. Escape from negative emotions. People may turn to behaviors like gambling, shopping, or internet browsing as a way to escape from stress, anxiety, or other negative emotions. This in the long run could actually cause an addiction. 3. Social pressure. Peer pressure and social norms can contribute to the development of behavioral addictions, particularly in cases where the activity is seen as acceptable or desirable within a particular group or culture. 4. Trauma. In some cases, behavioral addiction can be a coping mechanism for individuals who have experienced trauma or loss. For example, someone who has suffered a physical or emotional injury may become addicted to painkillers or other substances as a way to manage their pain. 5. Mental health conditions. Certain mental health conditions such as depression, bipolar disorder, or ADHD can increase the risk of developing a behavioral addiction. 6. Brain chemistry. Imbalances in brain chemicals such as serotonin and dopamine can contribute to impulsive and compulsive behaviors, which can lead to addiction. 7. Personality traits. Certain personality traits such as low self-esteem, perfectionism, or novelty seeking can increase the likelihood of developing a behavioral addiction. 8. Lack of impulse control. Individuals who struggle with impulse control may be more likely to engage in risky or excessive behaviors, leading to addiction. 9. Environmental factors. Accessibility and availability of their behavior can also play a role in the development of an addiction. For example, living near a casino or having easy access to online gambling platforms can make it easier to develop a gambling problem. 10. Genetics. Research suggests that there may be a genetic component to certain types of behavioral addictions, such as pathological gambling. It is important to note that these causes are not mutually exclusive, and many individuals who struggle with behavioral addiction will experience a combination of factors that contribute to the condition. Effect of behavioral addiction. Physical health problems. Excessive engagement in certain behaviors can lead to physical health issues. For example, excessive gambling can result in financial problems, poor nutrition, lack of sleep, and neglect of personal hygiene. Similarly, excessive use of the internet or video games can lead to problems such as sedentary lifestyle, obesity, and repetitive strain injuries. Mental health problems is another effect. Behavioral addiction can also have a significant impact on mental well-being. People with behavioral addiction may experience symptoms of anxiety, depression, and mood swings. They may also have difficulties in managing stress and regulating their emotions. 3. Interpersonal problems. Behavioral addiction can strain relationships with family, friends, and partners. Excessive engagement in addictive behaviors can lead to neglect of personal relationships, lack of communication, and conflict due to financial issues or time spent on the addictive behavior. 4. Financial problems. Many behavioral addictions such as gambling or shopping addiction can have severe financial consequences. Individuals may accumulate significant or gargantuan debts, struggle to pay bills, or engage in risky financial behaviors in order to sustain their addiction. 5. Decreased work or academic performance. Behavioral addiction can negatively impact one's ability to perform well at work or in academic settings. Increased preoccupation with the addictive behavior, decreased motivation, and impaired concentration can lead to decreased productivity and overall performance. 6. Decreased quality of life. Those struggling with behavioral addiction often experience a decrease in overall life satisfaction and fulfillment. The addiction can become all-consuming, causing individuals to neglect other important aspects of their lives, such as hobbies, social activities, and personal growth. 7. Increased risk of substance abuse. Behavioral addiction and substance abuse often coexist, as I stated earlier. Engaging in one addictive behavior can increase the likelihood of engaging in other addictive behaviors, including substance abuse. It is important to note that behavioral addiction can vary in severity and impact from person to person. Let's look at some solutions that will help us escape these addictive behaviors. Number 1. Identify triggers. Understanding what triggers the addictive behavior is crucial in addressing it. Keeping a journal or log of when the behavior occurs and what happens before it can help identify patterns and common triggers. Seek professional help. Consulting a mental health professional, such as a therapist or counselor, can provide valuable insights and strategies for overcoming behavioral addiction. They can help individuals understand the underlying causes of their behavior and develop coping mechanisms. 3. Join a support group. Support groups like Gamblers Anonymous, Sex Addict Anonymous, or Overeaters Anonymous offer a safe space to share experience, receive guidance, and connect with others who are going through similar struggles. 4. Develop self-awareness. Mindfulness practice, such as meditation or deep breathing exercise, can increase the awareness and help individuals recognize when they are about to engage in addictive behaviors. This awareness allows them to make conscious choices and intervene early. 5. Practice self-compassion. Treating oneself with kindness and understanding rather than judgment or criticism can help reduce shame and guilt associated with behavioral addiction. Self-compassion techniques include positive affirmation, gentle self-talk, and self-care activities like exercise or relaxation. 6. Find healthy alternatives. Engaging in alternative behaviors that provide a similar sense of pleasure or relief without the negative consequence can help replace addictive behaviors. For example, someone struggling with shopping addiction might take up gardening or painting instead. 7. Set boundaries. Establishing clear limits on time spent engaging in potential addictive behaviors. Setting realistic goals and developing strategies for avoiding relapse can be helpful. This may involve removing temptations, using accountability software, or enlisting support from friends and family. 8. Gradual exposure. Gradually exposing oneself to situations that trigger addictive behavior while practicing new coping skills and strategies can help build resilience and confidence. This approach should be done under the guidance of a mental health professional. Cognitive behavioral therapy, CBT for short. CBT is a useful therapeutic approach for treating behavioral addiction by helping individuals identify and challenge distorted thoughts and beliefs that contribute to their addictive behavior. It also teaches skills to manage cravings and avoid relapse. 10. Medication. In some cases, medication may be prescribed to help manage symptoms of co-occurring mental health disorders such as depression, anxiety, or ADHD, which may be contributing to the behavioral addiction. 11. Lifestyle changes. Making significant lifestyle changes such as changing jobs, ending unhealthy relationships, or moving to a new environment may be necessary to break free from behavioral addictions. Finally, holistic approaches. Alternative therapies like acupuncture, yoga, or art therapy may complement traditional treatment and help alleviate stress, improve mood, and promote overall well-being. It is important to remember that overcoming behavioral addiction is a long-term process that requires patience, persistence, and support. Individuals may need to try various combinations of these solutions to find what works best for them. Please subscribe, like, share, comment, and please put us on push notification so that you'll be one of the first to know anytime we post a new video. Thank you.